So now we'll move on to an outreach coordinated care model presentation, and I'll hand it over to Colleen Brandt-Schulter, our Human Services Manager, and Theodore Bowe, our Police Chief, and community partners.
Good. I know we have to kind of peek over because we brought such a great group today. So, so good evening, Mayor, Council, staff, and the public. Per the Mayor's request, we are here with our King County and City of Burien contracted providers to provide a brief overview on our Service First efforts focused on homelessness. Chief Bowe and I are pleased to introduce the approach and the many partnerships that we work with.
Thank you. The role of the agencies here today is focusing on response, relationship building, service delivery within the resources available, assisting with navigating the greater homeless response system, including coordinated entry, and working with people that sign on to their programs. As service providers, they do not implement government actions or policies, but rather relay government decisions, rules, and policies so their clients better understand our plans and expectations.
Next slide, please. Our efforts to create a coordinated care model are positioned to address a person's behavioral, shelter, medical, legal, and employment needs. Using a client-centered coordinated care approach optimizes wellness while maintaining strong linkages with community agencies, connecting clients to trusted local resources, and facilitating timely access to primary care, specialty care, basic needs, legal representation, medications, and supportive housing. Our goal is to cultivate connected community-based partnerships in Burien that emphasize client-identified goals supported by care providers. Extended partnerships also include faith-based and community volunteers. And so with that, we'd like to hand the presentation over to our partners. Next slide, please.
My name is Aaron Burkhalter. I am the project manager for the LEAD program in Burien and White Center. LEAD has a couple of meanings to it, going back historically from the very beginnings and still used today. It stands for Law Enforcement Assisted Diversion, established in the Belltown neighborhood about a dozen years ago to address open air drug trade in that area. It has since also been defined as let everyone advance with dignity. When we opened up previously, we'd largely just had law enforcement referrals, and we opened up to community members. That definition was added as well. LEAD is a long-term intensive case management program in which staff we work with help clients access existing community services, treatments, and resources. The people that we're working with are living in extreme poverty. They live with a behavioral health condition, such as being in active drug use or having a mental health condition. And they are involved in law enforcement or the criminal justice system. Many of them, and I may touch on this a little bit later, are people that are struggling in other programs and need that additional case management support to help people connect with the services that they need. Our case managers, in that case, we consider them brokers of services. They build on ongoing relationships with participants to help them see the possibilities of change in their future and help connect them with the services that they need to find that. We work in a model where we're looking at the person from top to bottom and trying to figure out what all their needs are, their strengths, what are the areas of growth, and to help them figure out the next steps they need to take to pursue lasting change. Clients are often at different stages and have different capacity to pursue treatment, employment, housing. So the case managers work with them to establish achievable goals and achieve those goals. This is all done with the intention of reducing the harm that individuals are having on the community, as well as the harm they experience from simply what it's like living in extreme poverty or living with these behavioral health conditions. The referrals come to us a number of different ways. Well, 3 ways, I should say. One is that law enforcement just provides us the referrals. We get a call from, say, Detective Scott Mandela, who says, I've got this person that I met out at the encampment. This is what I know about them. We think they need some support. This has actually been a really great way for Burien to bring people into it. Doesn't happen at the arrest because we have proactive police officers who are connecting with people and building relationships quickly and identifying them to us to let us know that we can help them. Officers have the ability in a second way to make a referral at the point of arrest. They don't happen often because of that proactive nature of our police department, but they did just happen in the last couple of weeks. And then community members are also able to make referrals. Chief Bo, I'm stealing his language, has referred to one aspect of our work as the secret sauce, and that is what we call our operational work group. I know there's a lot of terms and acronyms, but the big piece to take away from this is a time when law enforcement, case managers, human services from the city, prosecutors from the county and city come together to discuss clients and figure out what the best course of action is. The people in this space will often tell you that they did not imagine that they would be sitting in this table with all of these partners coming together, working towards the same goal. And then I would just say the partnerships have been really so strong that even as other lead programs in the region were struggling with this, we never missed a meeting through the pandemic and were able to stick together and keep working for the community as we went. Currently, we have about 100 clients and at least 9 staff members. I say that because the REACH program that does the case management work has a massive supportive infrastructure behind them to help people. We try to maintain relationships with law enforcement, the city, the school district, businesses, religious organizations, and other service providers. Thank you.
Next slide. Oh, there we go. No more slides. Hi, everybody. My name is Becky Gilly. I am the outreach manager for South Seattle and South King County. Just wanted to talk a little bit about the 2 different REACH programs that are down here, including the Burien Neighborhood Outreach. It is funded by the city of Burien, and the goal with this program is to engage with clients of both high and low needs long-term and connect them with appropriate fit services and resources as available. This can include medical, mental health, substance treatment, becoming document ready, getting connected to public benefits, and connecting folks with shelter and or housing as available. Until those goals are met, we support clients in meeting their basic needs in stabilization and survival, including food, water, wound care, hygiene kits, overdose prevention, phones, and sleeping bags. In the last year, there were 516 different site visits at 27 different encampment sites in Burien, and that included 664 unique unhoused clients. We collaborate with the LEAD program, public health, mobile medical van that visits Transform, street medicine team who we can call out for specific health-related referrals, Salvation Army, Evergreen Treatment Services is the methadone clinic, and the library, UGM, building connections with the city and different businesses and other service providers available. Next slide. And then the other program is the Healthcare for the Homeless Network outreach provider. It is pretty much the same thing with a stronger focus on the higher medical needs and high vulnerability clients. So we're still working across the different service providers and doing similar efforts with that strong focus on highly medically vulnerable folks. This program receives federal funding. And then across the 2 of them, they both need access to local shelter and housing opportunities, including and also long-term case management for highly vulnerable, diverse populations. Next slide.
It'll be Daisy.
Hi, good afternoon. My name is Daisy Espinoza. I am a Sound Health employee. I work specifically for the law enforcement corresponder program. I have a master's in social work and have been experienced with case management. I am paired up with Detective Scott Mandela, a 15-year-old veteran of Burien PD and experienced crisis intervention team member. A great number of 911 calls are not related to law violations, but do involve requests for welfare checks and persons in crisis, suicidal individuals, for instance. My training and experience, paired up with Detective Mandela's training and experience, is grant funded and adds our specialized team to the already stressed group of patrol officers. As welfare checks and calls related to persons in crisis get dispatched, our team is often able to handle those specific details while the traditional patrol officers investigate crimes. We are very familiar with existing case management programs and often refer persons in crisis to those programs for long-term case management and counseling services. Those programs are often too difficult for persons in crisis to access on their own. One long-term goal of our corresponder efforts is to simplify access to those programs for clients in crisis and to ease the coordination of care between service providers and healthcare professionals. Thank you.
Hi, everyone. My name is Lindsay Mueller, and I am the mental health professional co-responder with King County Fire District 2. I'm also an employee of Sound Health. So the King County Fire District 2 CARES program is a mobile integrated health service. Our goal is to provide enhanced services to frequent utilizers of 911 to address any unmet needs that patients may be experiencing that lead to using 911 for a non-emergent concern. An additional goal in this is to reduce the strain on our first responders and our firefighters to address those non-emergent concerns so that they're ready and available for acute medical crisis or a fire. We operate as a partnership with myself. I'm a clinical social worker. I hold a master's in social work, and I'm partnered with a firefighter EMT. Together, we are able to address these complex medical and social service needs of the patients that we're seeing. We operate in a couple of different ways. We're dispatched out by Valleycom Dispatch to specific calls. Our crew members, our other firefighters can make a referral directly to our CARES program when they are out on a call and they see a patient who might be in need of some additional support. And then we also can go through our patient records and proactively reach out to folks that we have noticed maybe a pattern in their behaviors and notice a high frequency in 911 usage. Some of the examples of areas that we can provide support to community members include helping folks get access to in-home medical care services if they're struggling in their home, or caregiving services. We also have helped a number of folks get access to substance use disorder services like medical detox and long-term treatment services. And then if patients have existing service providers, whether that's a behavioral health service provider, a medical doctor, or anyone else on their care team, we can connect with those with the patient's permission to work on exploring what's going well, and then what aspects of a treatment plan need some further attention. We are city funded. Like I mentioned, I'm an employee through Sound. Being that our CARES program is relatively new to King County Fire District 2, we're working on developing relationships and partnerships with our local hospitals, other community service providers, as well as learning from established mobile integrated health and community response programs. One of the great aspects about our program is that it is highly patient-driven. Patients are able to identify their own personal goals while we may get called out for a particular reason. If we're working with an individual and we learn that there's an underlying need that might need to be addressed before a behavioral health condition, such as housing, access to food, or things like that, then we tailor the plan based on the patient's identified goals. We also have the ability to do some internal referrals through Sound that has a number of different programs that we can access, as well as utilizing other local resources. One of the greatest needs that our patients are seeing are just systematic barriers to accessing services that they desire. For example, we've run into a number of cases where insurance coverage is a limitation in getting the adequate behavioral health treatment that individuals need. And additionally, meeting eligibility criteria for certain programs, while some folks are struggling with a substance use condition, they also have other immediate concerns that need to be addressed as well, such as ensuring that they pay their rent to maintain their housing. And that's hard to do if you're in a treatment program for 90 days. Yeah, thank you. Next slide.
Good evening, everyone. My name is Anna Maria Gueco. I'm a licensed mental health clinician, and I have been a program manager at Sound for the last 16 years. Sound, which employs both Daisy and Lindsay, is a large behavioral health community-based organization here in King County. We serve upwards of 20,000 children, families, and adults here in King County with clinics in North Seattle, Central Seattle, Bellevue, Auburn, and Tukwila, which is where I work and which is where our PATH program is based out of. PATH is a SAMHSA federally funded evidence-based program. It stands for the Project of Assistance of Transition from Homelessness. That's why we call it PATH. And it primarily works, you're going to hear a lot about outreach programs here tonight. PATH is specifically funded to work with those individuals who have a serious and chronic mental illness. This is what's preventing them from exiting the homelessness system. And these are individuals who are not already connected to mainstream services. They don't have entitled benefits. They're not going to Sound already and getting mental health care. So we really primarily focus our services on those individuals who don't really have services yet. PATH has been funded by the county here in King County for roughly over 15 years. We've been doing outreach in South King County for roughly 15 years. And we've been funded specifically by the city of Burien since about 2017. We had a presence in Burien prior to that, but with the funding from the city of Burien, we're able to focus our time here in the city of Burien as well as the other cities in South King County. We're primarily street outreach. These are individuals who aren't going to come looking for services on their own. So we tend to go to them. Our outreach workers tend to spend quite a lot of time at Transform Burien, as well as the Burien Transit Center. And that's where they tend to meet a lot of the individuals who qualify for PATH. Although we do take referrals from anyone. Colleen has called us before and said, hey, come talk to this person. We really, really focus on building rapport. These are not individuals who are going to, quickly accept help and then, find themselves into housing. They need time. They need to build trust with someone. That's what we do. We take the time to build their trust, to gain it, and then assist them with connecting to the services that they need, which is often mental health services or substance use disorder services. And I threw some numbers in the slide for you, but we're in 2022, we served roughly 30 seriously mentally ill homeless individuals alone in the city of Burien. And while that might seem like a small number, it's more than what we're contracted by the city of Burien to serve. And so we are trying to meet that need. We are a very small program, but again, we work very specifically with a very specific population. One of the exciting things that we have going on is through our federal grant, we recently got about $20,000 to use specifically for basic needs, rent, eviction prevention, other funds that we can use to help build trust with these individuals and exit them on and transition them on to other housing. We also, our path is our primary referral into our South King County Housing First program, which is exactly what it sounds like. And so we have transitioned seriously mentally ill individuals from the city of Burien into our Housing First program with no barriers, just getting them into housing and then getting them the services they need. Thank you. Next slide.
Hello, everyone.
Sorry, I lied. I'm so sorry. It would be Anne next. Oh, I think you're muted. Anne, I think you might be muted. Thanks, Quentin. Anne, we still can't hear you.
Are you able to unmute yourself, Anne?
Can you hear me now?
Yes, we can.
Oh, I'm so sorry. Sorry. Oh my gosh. I don't know what just happened because I do this all the time. So I apologize, everyone, for making you wait. But okay, you got me. You're hearing me. Okay. Sorry, folks. So first of all, thank you for having us here. I really just have part of the reason that I was like late for this is I was taking notes on everything my colleagues were saying because I want to make sure that we're in connection with them. So I'm going to talk a little bit about the mobile medical van program. It is part of our public healthcare for the homeless network, which is known as, HCHN. The South King County van, actually, so I'm going to actually, unfortunately, read. I usually do this by memorization, but I wanted to make sure I didn't miss anything. So I'm going to do a little bit of reading. But I started with a thank you. As I've been listening, I just wanted to make sure that I heard Cindy, council member in the beginning, for important words. I want to thank you for that. Rebecca, and discussing our collaboration, Daisy. There's a lot of people that spoke to our collaboration, and I just deeply appreciate these folks, and they're like heroes in my mind. So our program consists of the South County Mobile Van, Seattle Van, and Street Team. Street Team also actually serves South County. It's a small, nimble team, but very mighty. So they do serve folks and Street Team only serves folks living outside. We call that rough sleepers. So they might see folks that the mobile van would never be able to see because they're folks that are like, don't even want to approach the van, not even a clinic, not the van. So it's an important thing. I want to make sure you know about that. So our program provides services to thousands of clients each year. The South County Van partners with MTI, which is Medical Teams International, to provide the dental services that are funded with your funding. Thank you, with our Burien funding. So Medical Teams International provides the dental van and driver, which is huge because, not sure if you know this, but to provide dental services in the field is an extremely challenging thing to do. So they have two, what they call basically they're two fully clinical rooms. And they see folks for not like cleanings, but emergent situations. So you've got a tooth falling out, you can't, there's tons of pain. So I have to say that the reason I especially want to thank this for you all for this funding is that folks that have pain, even if they have anything else going on in their life, pain is a driver to come to us. So it's been very helpful to be able to provide dental services because we see folks, as you are well aware, that are not going to go to like a dental clinic and make an appointment. So MTI we partner with. So our program, Seattle King County, provides the dental provider. And then next here. So we want to let you know that most of our services are provided in either day, community centers, shelters, temporary housing. Basically, we're trying to provide services where something else is happening because primary care is not a driver in itself. So before the pandemic, it was fairly easy in South County because there's so many churches doing hot meals and we were able to see folks. This has changed post-pandemic. A lot of the churches are now giving out like a bag, here's your lunch, goodbye. So we've really had to work hard to build relationships. But those are the kinds of places we go. And I have to say that so I was the nurse 14 years ago at Transform Burien and Burien before we had to move to the other site. And that was such an ideal site because I'll give you this back, like, I think it's probably obvious, but if you have a place where there's a hot meal, clothing, hygiene supplies, a place to take a shower, a bathroom, that's really going to bring clients to us. So we really appreciated that site. And now, unfortunately, the move to the newer Burien site was not as successful because I think there's not as much walk by traffic. And I want to thank right now Colleen and everybody with Human Services in Burien because they have done nothing but help us to figure this out. They have been so supportive. Unfortunately, though, that site is not that active. We tried for the library, for closer to downtown, but we understand that can be challenging for businesses and that kind of thing. So I think it's good to come to figure out an agreement where it works to be. I want to make sure you know what services we provide, and it's walk-in primary care, acute and chronic conditions, diabetes, asthma, etc. STD, HIV, and Hep C testing and treatment. I'm not sure if you all are aware that we have also, in addition to our COVID pandemic, we have a syphilis epidemic. We have so many people diagnosed with syphilis that, and I have to tell you, our street team that also serves Burien has an 80% treatment rate for folks that have syphilis. And it's not an easy disease to treat folks for. So I want to make sure that you're aware of that. We do family planning, access to behavioral health and chemical dependency services, lots of things. So let me move here. We were asked to talk about sort of how we reach out to folks and why it works. So I think everyone that went before me didn't necessarily name this framework, but I think they're all operating under this. And this is a trauma-informed practice, patient-centered, multidisciplinary team, and a lens of equity and social justice. So just to let you know, there's like, we have the dental van, we have the mobile medical van. Who's on the van? A social worker, a public health nurse, an educator, a harm reduction specialist. So all these people, so if I go to the dental van because I have pain, that's all I want. But I meet these folks that are super cool and welcoming, and then, oh, let me connect. So we have actually a 50% rate with our dental clients of connecting to other services. So that's pretty high. If you look at other other stats and other places, we have a very high rate of connecting people to other services. So why does this work? We return to the same sites each month for consistency. We try to locate places where there are other services provided, as I just said, like Transform Burien. We have a multidisciplinary team. The entire team works to build trust. We always say our only goal is for you to come back again. So if that means that you come and we're like, your blood pressure is sky high, you're about to have a stroke, you don't want to deal with that. Okay, we're like, okay, what do you want? I want some socks. Great, here are your socks. Without presenting urgency about, oh my God, what's happening? Actually, we build enough trust that that person will come back and we actually do deal with their blood pressure. So the team has a monthly case conference where 8 individuals from different agencies. So we work with Reach, HealthPoint. We all work together, and that helps us to gain inroads into those agencies. And they literally talk about every client and see what else can we do for them. We also collaborate. One thing I want to mention is we were having our dental clinic at Transform. Was super slow. So we moved to Navos, which is a mental health agency in Burien, as you know. We have a clinic there. We moved the dental program there, and guess what we found? We started seeing folks, all homeless, that have persistent and consistent mental health issues. And this is the first time for many of them to have dental care in years. So I know I'm probably almost out of time. So let me just give you a few highlights. Obviously, we collaborate with other aid. So on our van, our partners are 2 LCSW, like 2 social workers that actually work with HealthPoint. So if we can't get them into the Navos clinic, guess what? We get them into HealthPoint. And we're actually expanding to make relationships with every single community health center around us to make sure that we can find inroads to and build more relationships. We had a success. We had 101 visits in Burien in 2022. That's the data we have right now. And as I said, 55% were connected to referral sources. I'm sure this is an undercount because during COVID, we had very little bandwidth for this, but we checked this, and these are not small referrals. These are like significant things that folks were referred to. So we were also asked to talk about community requests. What do our clients ask for? Obviously, housing, right? Many kinds of housing, low income, permanent, supportive, housing first models. I didn't put this on the slide, but our recent point in time homeless count showed that we had about 13,000 folks in King County living homeless. But when we did an analysis that included other data points, it comes to 40,000. We have over 40,000 people living homeless in King County. That's the 3rd highest rate in the nation. So what else do our communities ask for? Our clients have asked, one of the most important things that I would love to share here is that they've asked not to be moved or displaced. This interrupts not only our ability to provide necessary ongoing medical and behavioral health care, it also increases opiate overdose risk and ability to treat for COVID or other diseases. So as you know, folks get moved to another place and then they go back to the old place. Like moving people back and forth is not saving anyone money. And it's actually making it really hard for us to treat communicable diseases. Our clients have asked also for access to hygiene services and supplies as a basic right. If you imagine walking around downtown Burien, and if you're someone that is living homeless and maybe haven't had a chance to bathe for a while, going in and asking, can I use the bathroom? You're often told no. There are very few hygiene centers that we really need this. We also need safe spaces to be inside during inclement weather. We say when it gets to 32 degrees, we start these, but can you think about if you're sleeping outside without a sleeping bag in 32 degrees? That's not soon enough. And then accessible mental and behavioral health services. We try daily to refer folks to treatment. And I'm sure everyone here is aware that there's a backlog. We can't get them into treatment. And so, especially when folks leave jail and come to us and they only went in jail, likely because of their mental health issues, they come to us when they get out, and we're watching people go through, a revolving door. Not helpful. So we're also working on creating relationships with both the jail release planners and community health centers. So then when someone comes out, they have a 7-day supply of meds. When they come out, we're saying, come to us right away. We connect with them, and then we try and hook them up with a provider that can prescribe, like follow up on their prescription. So we literally, I'm done. Am I done?
But I just want to move us along to we have 2 more presenters.
Okay, sorry. Okay, that's it. I think we're done. Sorry for taking so much time. I just appreciate everyone here, and thank you for the time that I've been given.
Next slide, please.
Thank you. Hello again. Thank you for having me here. My name is Tina Lewis. I am the program manager for Salvation Army Street Level Ministries. We are a mobile vehicle outreach team. We started in 2019. There was just 2 of us at that time, serving only South King County. That's how we ended up here in Burien. Since 2019, we've been working with law enforcement very closely. Once a week, the teams come out and they do outreach to those folks living in their vehicles out here. We do assist other folks that are out here that might need assistance when we encounter them. But our main focus is vehicle outreach and moving folks into permanent housing. Now, today, we have 4 mobile offices that are out on the roads, serving all of King County at this point, with a new contract that is just now starting into the Central District of Seattle as well. So we have the 4 vehicles. Each vehicle is equipped with a landline, a scanner, a printer, a fax machine, Wi-Fi setup, and laptops. We also provide all the necessities that a homeless individual could need: snacks, water bottles, hygiene kits, clothing, socks, hand warmers in the wintertime, everything possible that they could need out here on these streets. Like I said, our main focus is to move folks from homelessness to permanent housing. That is our end game. We're always a housing first model. We do assist clients with any barriers that they might be facing, and that is the purpose for the mobile office, so we can meet people and do things in real time. We can do housing stability forms. HMIS packets is how we, keep everyone in the system and keep them straight. We can apply for photo ID, social security cards, things of that nature, make copies of their documents. So it's a very helpful process to be able to have this mobile vehicle out here to assist these folks. Our funding comes from multiple places. We have city contracts in different cities, servicing those particular cities. And we have King County funding. We are funded by King County for all of King County right now. We work as far as the east side with Kirkland, Bellevue, Redmond, and we go as far as Maple Valley, Burien, Renton, Kent. So we're everywhere. The key thing about our outreach program is we partner very closely with law enforcement. Every time we're out doing outreach, we have law enforcement present with us at that time. So there's usually an officer with us in these cities that escort, that'll lead the way, because they usually know where people congregate in vehicles. And so that's why it has been a very good relationship to work with these law enforcement officers in all these different cities. Today, we service over 22 communities. Each van has one male, one female. And like I said, there are 4 vehicles and a truck. There's many obstacles that clients are facing. It could be employment, lack of credentials, things of that nature. We will help each one of these clients get past those. Not everybody is ready for housing immediately. So when we run into those folks, some people might want to go to treatment. We do have very close collaborating partners that we work with treatment facilities. Some of them go into transitional housing, and some of them go into shelter placement as well. We use the shelters under our own umbrella of the Salvation Army first. If those are full, then we do work with other places such as Fusion and Mary's Place and other shelter programs. The greatest need, of course, is permanent housing. That's what everyone wants. And so with that, we will assist a person with their application fees, assist them on finding multiple apartments. It is voice and choice. And so we use that model. We will find multiple places, allow them to look at these places and see what they like, where they want to be. Of course, when you get to a person that lives in Burien and that has been homeless out here on the streets, and you ask them, what city would you like to live in? They're always going to say Burien. They do not want to leave this city. They love the city of Burien. So we will pay for those application fees. We will work with property management companies, landlords of apartment complexes. We will assist these folks with paying their first month's rent, their deposits, whatever it takes for them to get in. If they need employment, we will work with them with temp services, different agencies that we have been working closely with to get them employment and get them established. Some people cannot work, so we will get them set up with their Social Security or DSHS or whatever we can to eliminate all those barriers that they are having. As of today, we've housed 61 people from homelessness in their vehicles to permanent housing in the city of Burien. Right now, we're on track to house 1,300 people for the year in all of King County. By the end of the fiscal year, we will have hit that goal. By the end of the month, we'll have hit the 1,000. So we're averaging right now 125 people a month being permanently housed from vehicles to permanent housing. And that's it. That's all I have.
And our last presenter is Ravenna from Navos.
Hi. First of all, I can't see anybody, so hopefully you can see me. If you can just somebody say yes.
Yes.
Okay, great. Yeah, so I'll make mine brief because I know I'm last. I just, first of all, wanted, for those of you that are parents, say my son who's 13, I'm raising a teenager. I think he took advantage of the fact that I'm the last slide because he grabbed his swim trunks and said he was going swimming at Alki Beach. So now my brain is somewhere else, but I can definitely make this quick. First of all, Navos began in 1966 for South and West King County. It was created by concerned local residents who saw an unfilled need for affordable and accessible mental health care. In 2010, Ruth Dykman Children's Center joined Navos, and in 2012, Seattle Children's Home joined Navos. And Navos was also acquired and is now affiliated as part of the Multi-Care Behavioral Health Network, along with Greater Lakes. I have actually been with Navos now for 18 years, although it feels like a minute because of all of the different exciting programs I've gotten to build over the last 18 years. One of our strengths is building affordable housing. And we've actually had several governors tours over the last 10 years where he has come and looked at all of our housing that we built from the ground up to help rehabilitate people out of hospitals and back into the community. We have many programs like this. One is in West Seattle. It's a village with a gazebo and a garden and cooking classes. We also have built housing specifically for our PACT population with beautiful modern studios. Another feature of Navos that's a huge strength is population health, which is improving equal access to education, housing, medical care. We provide this by working directly in the clients' homes and in the schools. We also drive individuals to medical care and coordinate really closely with King County Public Health. We partner really closely with the sheriff and the fire department. We've created and built a lot of affordable housing in the last 18 years. That was my number one goal. And we also address food security by having cooking classes on site and working with all of you out there. Our funding comes from King County. We also partner closely with University of Washington School of Medicine, DSHS, and the state. I'll never forget the day that I saw real estate agents at this apartment complex across from beautiful private Lake Burien. And I called our senior leaders and said, this apartment is up for sale. We believe in trauma-informed care housing, and we made a bid, and we actually bought that brick apartment complex, which now houses our PACT clients, and it's absolutely beautiful. So our whole focus is to create housing that doesn't feel institutional and creates a second chance at life. We have won many different awards over the years. We won the Advocacy Award from King County, Population Health Award, the first clinical team that won a Population Health Award, and a Housing Development Award from King County. The Population Health Award was actually from Multicare. I'm really excited to still be at Navos, and if you want to check us out, it's navos.org. There's a lot of interviews on there and links to our interviews on, for example, Como 4 King 5 News, and a lot of educational info on there, all the open job positions, if you know of anybody that would like to work there, as well as all of the statistics from our outcomes. And I'm just under 8 o'clock. So thanks for having me. And also hats off to everyone that spoke before me. We love partnering with all of you, and we couldn't do it without you.
Thank you, everyone. Questions from council?
Yeah.
Councilmember Garcia.
I do. Thank you. First, I want to thank all of you for all the work you do and are doing and have done. I know that historically our lack of housing and our lack of behavioral health care and mental health care has contributed to this crisis. And you guys are literally on the ground fixing what generations of leaders were failed to address. And we're now all playing catch up while you're all literally putting yourself at risk at times to help others at their lowest and low. So thank you so much. So one of the first questions is, can you just repeat how much funding you get from the city of Burien for each of your programs? If you don't mind going by line, just real quick. I just want to make sure how much funding you get from us.
LEAD is not funded by the city of Burien. Right now, our funding comes from the county through the Mental Illness and Drug Dependency Fund.
I don't have that number for you. I'm sorry.
Okay.
I can speak to that just because I'm public health. We have many complex programs, but we receive funding from there's a group of South County cities that gather. So we get funding from that. And from Burien, we get about $10,000 for the year.
Okay. You also mentioned, I think the lady that mentioned about 20,000 in essential needs.
That was me.
Okay.
We received, so the PATH program specifically at Sound receives 10,000 from the city of Burien specifically. That 10 grand funds our outreach workers. So actually pays for what they're going out in the community and doing and serving the clients. The $20,000 that we just recently received is through our federal contract through King County. So that comes directly from the federal PATH program. I thought it was worth mentioning because it is funding path specifically has not ever had before. So it's actually going to enable us to do more. We've done a lot with very little. For the last 15 years, we've never had funds like this. So that's why I mentioned it.
And I ask just because, we get what you pay for, and we're literally not investing enough. We don't have enough. Our city just doesn't, frankly. We just don't. But I think it's something that's important that we all recognize, especially as our entire council being here present. I'm really thankful that we're all here able to see the people that are actually doing the hard work, because this is traumatic for our communities, for the folks, and for yourselves. So I just really appreciate everything that you're doing, and will do as much as I can to support future funding opportunities, because I think it's very important that we do that. But we have to start with housing, because this is a housing crisis. So I want to just make sure that as our council looks at our comprehensive plans, sub-area plans, that we realize that affordable housing, the lack of affordable housing has us in the situation, and for us to make sure we work with our partners to get those behavioral care centers that now recently the county passed for some funding, because we need all of that. But more importantly, we need to support people doing the work. So I just wanted to say thank you. Thank you, Mayor, for allowing me to speak.
Did you want others to answer your question about funding? Because I saw 3.
If they don't, that's my guess. It's probably our ARPA funding that's covering. No, none of this is covered by our ARPA.
Our co-response are ARPA funded. Some are general fund, and others are not funded by the city.
So.
And co-response only with fire. King County is covering our MHP with PD.
So of the 61 Burien vehicles that were moved to homes, we didn't really fund any of that directly?
No, those funds are from King County contracts.
So
we're just all of them, South King County.
We're benefiting from all that without actually paying for it. Is there any other services like that we're benefiting from without paying for them? Or is it all of them? Basically, all of you here. Okay, I just want to clarify that, make sure that's clear, because that's important for us to know.
I'm not sure what you're asking, but I want to make sure that your funding helps us, bring that dental van, but we also bring, without our mobile medical van, and our street team has no funding from the city of Burien, but of course we want to, so I'm not sure if that's what you're asking.
That helps. But
yeah, and it's not, yeah.
No, you answered it.
Public health is responsible for serving the county, right? So of course we're going to be there, but yeah.
Thank you.
Okay. Well, just to clarify, the co-response teams are ARPA.
Co-response with fire is ARPA.
Okay.
Co-response MHP with PD is King County funded. LEAD is King County funded.
Right, we got that one.
REACH
King County Fire is
funded through ARPA.
Okay.
And CARES. The EMS levy funds the firefighter. We fund the MHP through ARPA.
And the only one, Navos, do you receive?
We do not receive City of Burien funding. We are funded with contracts through King County and the state, or DSHS and University of Washington School of Medicine.
We do fund the early infant childhood mental health program with NABOS as well through general fund.
Other questions or comments? Councilmember Mora.
Yes, thank you guys all for your presentation and all that information. I got a lot more numbers than I was actually expecting, so thank you for all that in depth. I was wondering, we had an encampment here on 152nd and 6th Avenue recently. I was wondering how many of those you guys were able to place into services or housing, shelter, whatever it was.
That specific we were also able to.
Sorry to interrupt, Colleen, would you please hand him the mic?
Can you also identify what organization you're with?
I'm sorry, I'm Richard with the Salvation Army street level team. That specific encampment, we were able to move at least 4 people into detox, with them going into a 28-day program after that. We moved a couple of people, I think 3 gentlemen into an enhanced shelter down in Seattle, as well as a couple of ladies that got into Hope Place at UGM. So
is that 7 people? Am I correct in that?
7 to 10 people. I might be missing a couple, but about 7, yeah.
Okay, thank you.
Sorry.
I think this is one of the instances where the lack of local resources in shelter really was apparent, because when we talk about Seattle sweeps and removals, we're talking about getting people into those Seattle City funded shelters. So that is a lot of the experience that I have working at those sweeps in Seattle. City of Burien doesn't have access to those shelters. So City of Burien has access to, like, thank you, street level, for getting your person into the enhanced shelter. Those are very few and far between. Yeah. And often those beds are going towards prioritized sites in Seattle. Burien doesn't have prioritized shelter for folks.
Yeah. May I ask another question? Sorry. So are you saying that you guys aren't able to move people out of these because we don't have shelters here or any more beds here in Burien?
There is Hospitality House, which is I think 90-day program for women who are ready to work. And are there other beds here? Are there shelter beds here?
Well, I'm just confused. I honestly thought that the organizations were able to place people into any beds in King County. I didn't realize you guys were only working with beds in Burien. So I guess that was new to me.
I can respond to that, is that our outreach workers try to use any beds, and I work in the field a lot. And recently I was in Kent and someone needed housing, and I just called 211 and worked with them to wait on the phone. So I'm quite sure that anyone that is looking for housing for someone is what we do is we ask the client, would you be willing to go here? Would you be willing? And if they're like, no, hard no, then we're looking for the local resource, which we often don't have. If we can figure out if they're willing to go to another city, we might have more options. But yeah, I think there's this belief that when sweeps happen, there's housing or beds or this for everyone. And honestly, like, that's not true. And we sweep people to another spot and another spot, another spot. But I have not personally in 15 years working in this seen robust response for getting a bunch of folks into housing efficiently.
To part of your question is, LEAD did get people from the library encampment into shelters that were outside of Burien. It was really turning over every rock to find those and be able to get access to those, and there are limitations. I do have some numbers that I apologize. I was just looking on my phone to see if I could pull them up really quick that I could provide after the meeting to give a sense. In the LEAD program, we are going to look anywhere. We're not just, bound by the Burien borders, but as Becky was pointing out, there are a number of shelter spaces that we simply do not have jurisdictional access to. So I think it's an ongoing conversation, and I certainly appreciate all the conversation you all have been having as city leaders to figure those questions out. So thank you.
Councilmember Mata. Oh, I'm sorry. Did you have a comment?
So my comment is we don't tend to use 211 at street level. We don't limit ourselves either. We will take referrals from any source. I am the main resource, the main referral source. I brought multiple flyers today that my program has put together. I bought business cards as well. I would take phone call from hospitals. I built relationships with schools in multiple school districts, just all over the place. It does not stop. If you contact me, whether it be lead, reach, I have folks calling from multi-service center. Fusion will sometimes call because they'll have a family that's ready to be housed and they need me to find an apartment. Someone out on the streets will call and state that, law enforcement calls me 1, 2, 3 o'clock in the morning. I take phone calls 7 days a week, 24 hours a day. Anyone can call my one and only phone that I have, and we will do our best to find a shelter, a transitional housing, whatever the case may be. We're going to search until we find something. Like I said, we have multiple shelter programs, domestic violence. We have a women's shelter. We have a women and men's shelter together that accept pets. If you came with an iguana, as long as there's a bed available on the male side or the female, Salvation Army is going to take them in. That's how it is. But any one of these agencies in here, we will always take your call.
Yes, first of all, thank you very much. I see this as a complex problem, and I think there's sometimes people that believe that they have a solution to something, whether it's, take people, put them on a bus and take them out of the community, or whether, let's have an encampment. But here's what I struggle with, okay? I struggle that it says that overdoses among people from all races and ethnicities increased 54%, but from 2019 to 2022, it increased by 119.7% among Latino community. So I just heard the word, BIPOC. I quite honestly, I'm just going to say it publicly. I don't go around changing Europeans' names. I'm a Latino, so I don't like the word BIPOC because the word today was used BIPOC. But here's the thing. In the Latino community, it says that this community here, and we have some businesses here, are being affected 50% more than any other business.
Yeah.
The Latino community, broken windows, drug use in front of their stores, in the individuals that should be in a mental health institution. Now, I think if we kind of say homelessness, because that's the thing I feel like it gets convoluted into. We say, well, people are anti-homeless. And I've been just here recently, mocked all over, social media, because that's the way we do politics now. But if we look at that and we see that we have a problem in the Hispanic community, I don't ever really see how much money is going into it by, breakdown. Yeah. With law enforcement, I don't see anything about, educating people with fentanyl, and that's devastating. Just said it's 119.7%, meaning that we're gonna have some mental health issues, because it's been said that fentanyl is chemically disbalancing and rewiring people. And so on top of that, I just read an article here recently, a couple of days ago, that the next big crisis is our baby boomers. They're going homeless in mass numbers, although it's a bubble because it says it'll come back down. So I have some concerns here, right? Because here's the thing. I go out and I talk to these, we talk about America and engaging that we do what we do for BIPOC. But when I'm in the neighborhood, I just, I don't see it. I don't see nothing in another language. I don't see any of the services in another language. And yet we're dealing with homelessness as well, but it's different, right? Like if I pull the statistics now, when it says about homeless Latinos in the United States, that's actually continued to grow. 84 million Latinos in the United States, 34 million can vote. They're only half vote, $2.5 trillion of the GDP. For the next 20 years, 1 million Latinos are turning 18. And if we see these numbers are saying that the young population continues to use more drugs, that means that we're gonna have more side effects. So for me, I'd like to, really have the conversation of figuring out, okay, here's what we have. Like I've just seen right now, I know we got novels here. Let me move it to the question, because I'm concerned about this. I read the news and it says, novels closing doors in Burien. Okay. Then I see Cascade mental health closing doors in Burien. Okay. And we see that we just passed healthcare crisis centers, which I'm 100% on board. Like we need them. In fact, we need one here in Burien. I've talked to community members here and business owners, and I am in the mindset, yes, if we do have housing, there's something different between housing where people are homeless because they've ended up getting sick. Even the prison system. I see some of our Latinos says we've been jailed in bigger numbers in the Latino and African-American community than any other community. But yet we got out of prison and there's there's just the programs aren't there, man. So you got to go back to the street. So I'm going, how do we make this better for the next generation? We talked about that we haven't built housing. Well, we also haven't had the biggest population retiring. And then we also haven't had, you bring the millennials and the Z generation, 87 million. So when we talk about this, I just feel like just fuel the fire, because what I'd like to see is when we talk about people suffering severe mental health and severe drug addiction. I mean, because those are the things that I have to go back to this community. The studies have already showed in our city that the Hispanic community gets hit, or the minority community, 50% more than other businesses. So I got a lot of people that are upset and angry. So what are the tools that we could give a business, right? If somebody's like, for instance, here this Sunday, must have just come out of the hospital. This individual was gashed. I mean, he has gashes all over him, bleeding. Okay. No clothes, no shoes. Left at Staples. So I'm glad that you said, well, maybe people should be using the 211, right? But like, I know I'm not going to call 911. First of all, I've been hammered by some people. We just don't call cops on anybody anymore. So what we do is we've just went over there and dumped them at the hospital, have our doctors and our nurses having to deal with it, with having to chain people to beds. I think that's inhumane. So I think as we move forward here, I'd like to hear more of how much money is going down through different communities. What tools can we give these businesses, right? We got Alibertos out here who's been hit several times. We got the Waku's Chinese restaurant's been hit several times. We got, somebody that sells gold out here has been hit, several times. Got somebody that had $50,000 stolen for several times. Now, this is when you say, well, it's the homeless. I can tell the community it could, it couldn't. We don't know. At the end of the day, it's criminals. Okay. So I think we got to separate what criminality is with somebody trying to get back on their feet. My son is completely against methadone clinics. Well, of course he's going to be. He had a dad. I was his dad, right? Had a job, made sure that he was taken care of. And I see my community members busting their tails to keep these business open, and they work 2 or 3 jobs, 4 jobs sometimes. But for myself, in my experience, a methadone clinic was great because I got to meet my pops, and he tried to kick the habit. But guess what? There's going to be some people that just ain't going to kick the habit. He's buried 6 feet under the ground. So those are I don't want to shy away from those issues, right? Yeah. And so how do we confront this as a community? Because you're coming into a very divided community, right? We have, this individual, not only was he suffering from mental health, he defecated in front of the sidewalk. On top of that, he was masturbating in front of, and the mom comes here with the little girl. So I think those are the things that we got to say, okay, well, we can't ignore them. Okay, what tools can we do as a community? Is it 211? Is it, is there a different number we should be calling? And if so, then we should put that communication out in English. The Asian community is the fastest growing community in King County. You know who the second is? The Hispanic community. And I just don't see that information really coming back to the neighborhood. So I just wanted to say that. And I want to thank you because I know you're the frontline worker. I mean, it's like when a building has to get built and I don't have any workers, I got to go build it, regardless if I'm working 2 shifts, 3 shifts. And so I want to thank you because it's a tireless job. And I've seen you out there, right? And but I don't have the answers to it. And I know nobody in this room or anybody in the 9th Circuit Court has an answer to it. But I also do think that some of those small mom and pop shops that are struggling, it's a real thing. And so we got to figure out how do we come up with solutions for them, right? And we've been trying in this community. I got to tell you that it's not for lack of trying, but it's for lack of figuring out, in my last thought, of how we can be better partners, not only businesses, community members. So thank you. Sorry about that, Mayor, for taking too much time.
This is Ravenna Candy from Navos. I just want to thank you so much that was super helpful. And I look forward to more probably meetings with you right at Navos where we can talk about this together with Chief Bo and Colleen. But I just wanted to clarify that Navos is not closing. On Friday, King County Public Health met with me and my boss to let me know that there was a B-Town blog article that I haven't seen, but apparently there's a title or something in there that indicates that Navos is closing. The King County Public Health Clinic on the 2nd floor of the Mental Health and Wellness Center is closing at the end of the summer, but Navos is staying open, and we're very committed to helping solve these problems. We have a lot of research and outcomes of what does work successfully with the housing, which I can share with you at another time because we've been doing this now for 20 years, building affordable housing and having really successful graduations and positive outcomes. And this is working with populations that have been in the hospital, criminal, jail, incarcerated, and serious substance use disorder issues. So thank you for bringing us all to the table here.
Thank you for that information. And it makes me wonder, how could we know better about who is affected? I'd be interested in, is there a particular age group that's affected more? So let's talk about substance use. What's the difference between certain populations? And are we doing different things for different groups of people because we know it's more effective? So those are some of the things I think that I'd be interested in learning about as we move along.
And I would say that our King County data group can provide a lot of those answers. And then I also wanted to add that when we are we use an equity model to find locations we're going to. And so that means that, we've picked locations, including one location, for example, where there are many, many monolingual Spanish speakers. And I speak Spanish. And when I was doing outreach there, and I went with a Latinx person, so it wasn't just like a white woman doing outreach, but we found that it was a disturbing amount of folks that only speak Spanish that did not know about Suboxone, about naloxone, about the things that can prevent overdose. So what we've been working on is making sure that we have all these materials in all language, like in at least the languages in which we see folks, which is often Spanish, Vietnamese, and a few others. And then trying to make sure that we're creating inroads with locations where we might not usually be finding Latinx folks and African-American folks, to make sure that we're doing the trainings that need to happen and the information that needs to happen. But I would say that, Mayor, we definitely can get you, I think, a King County representation of the data that you're asking for.
Thank you. Thank you. Councilmember Sarah.
Yeah, and Mayor Aragon, I want to say this was a great idea to convene this group of people. And I appreciate all of you for what you do. And also for, I appreciate your being able to pull together at the same time in the same place and give us all of this information. I think a lot of what you're hearing, the passion and the intensity, is because we needed to have this conversation and hear you tonight. And I hope that this is not the only time. I hope this is the first of many. When I heard the number of 40,000 people in King County living unhoused, and I thought about there are 2 million people, and that's 2%. Is my math right? 2% of the people in King County. So in a room like this with 50 people, one of them would be unhoused. That is just, the work you're doing is staggering. It's uphill work. I appreciate you for doing it. And I did want to ask one question. You talked about developing trust with people and how it's difficult. And I guess I appreciate that and wanted to ask how the handoff works when you've built trust with somebody and then your time with them is kind of transitioning out. How do you keep their confidence that their next person is also going to be trustworthy?
Well, very carefully. So I know we all are up here, and I do want to say, and I thank Colleen for bringing us all together, is because there isn't an answer, because it is a complex issue. That's why there's so many of us working in different capacities, working with specific subpopulations of these individuals who are homeless. And that's why. And so when I spoke earlier about our PATH program and specifically working with the chronically mentally ill, the seriously mentally ill, we take time. You can only help someone who's ready and trust that the help that they're being provided is really going to work this time. And so when it comes to transition time, I mean, I can only speak for PATH specifically, we're able to follow them for a period of time. A good example might be an individual, with severe mental illness, and we will connect them to the behavioral health provider of their choice. It doesn't have to be Sound. It could be Navos, it could be Valley Cities. And we, the way our program works is we can stay with them. So if that means going to appointments with them, if that means checking in with them while they build this new relationship, while they get settled in housing, our services with them essentially stop when they say that they don't need them anymore. And we can ensure that whoever's working with them now, or they've got what they needed to feel a little bit more stable, then we can slowly back away. But they can always come back. I will say, I didn't mention this earlier, but with PATH, someone can come back to PATH again, especially if they find themselves now housed at risk of losing their housing. We also, our number one referral to PATH is former PATH clients. So it's very common for us to say, hey, this person helped me out. Maybe they can help you too. And I bet that's probably very similar across the board, is people come to us because others who have been helped tell them to come to us. So I hope that answers your question.
And I just wanted to jump in real quick. This is Ravenna Candy from Navos. Once homeless enter our housing programs are open 7 days a week with staff, vocational specialists, substance use disorder counselors, therapists, ARNPs who prescribe medication, nurses, and peer support specialists. And we provide multiple services every day, 7 days a week. And typically that lasts 3 years. So that's what builds trust after they're actually housed. I know it's very difficult to get. Even often people that are homeless don't want to come into the housing because they're either paranoid, or they've had bad experiences, or they think they're going to lose something that they have right now that they like. But we provide touch points with them multiple times a day. We actually bring medication to them because oftentimes they do need medication. We provide therapy in their living room. We have group classes in the apartment complexes in the community room, so they don't have to drive. We try to take all the barriers away that could possibly interfere with their treatment. And it is a robust treatment model. So we keep them accountable by having a very robust treatment model, working closely with the University of Washington School of Medicine. So it's almost a science. And so the UW has put together a graduation model that we work closely with the researchers. And after they've achieved, for example, a certain number of metrics, which usually takes about 3 years, things such as a level of insight, natural supports, is able to understand the medications that they're on, determine what medications they need, can attend doctor appointments on their own, is able to take public transportation to therapy, is volunteering or going back to college, or has a part-time job. So it's a very robust. It takes on average 36 months. But the clients that sign up for this are very committed. They were once homeless or institutionalized, often for decades, or incarcerated. They're very committed. And after 3 years, they are scared to graduate, but they do it and they're successful. And it's really rewarding to visit them in there. They get to keep a housing voucher from PACT. So after they graduate, they don't lose their housing, which is one of their biggest fears, is if they graduate from our program, will they lose housing? They don't. They have a housing voucher. So we help them get a new apartment. And we also do a warm handoff with their therapist and outpatients so that the next 3 months, they don't entirely lose connection with our team. We provide a linkage to the outpatient program that they're now receiving therapy from. That might be Valley Cities, Sound Mental Health, or a number of different agencies outside of Navos, or it could remain within Navos. So I just wanted to share that piece.
I'd love to add something really quickly here, is that for the mobile medical van, so we're seeing you're talking about folks that are able to even join, any kind of housing, with our van program and the street program, we're finding folks that don't even want to go to the van, let alone, so it's trying to build very new trust. And so one of the things we do to build trust is we have, for the Seattle van, we have the provider have hours at the downtown clinic and For the South County van, the provider has hours at Navos Public Health Clinic, which is closing. So we have to figure something else out. But just want to let you know that it's very different to get folks to build trust with folks that do not want to touch the system. And so I just wanted to raise that we try very hard to just, our goal with our mobile medical and our street program is to get folks to a, what we call brick and mortar clinic, right? Not just the van. And so we do everything we can to get folks to where, Ravenna was just talking about. But we see folks every day that are nowhere near going to a clinic setting. And our goal is just to build relationships. So just wanted to let folks know that. And the helpful thing of building those relationships is having a doctor where they get to know the provider on the van, they start to feel comfortable with them. And then that provider says, hey, do you want to come see me at Navos? And they're like, yeah. So that's how we build folks. We build their trust and help them go back into the medical system. So that's our main goal. And it can take a month, a year. We've had someone that for 2 years didn't speak, literally didn't speak. And our social worker sat with him at the lunch meal every day. Every time we went there, she just sat next to him. And now he's housed and everything. So I think we really know how to support folks that are not quite ready for, housing and following the rules, So sorry, just wanted to mention that.
Councilmember Manager.
Well, I want to thank you. One of the things with novels, I just want to let you know that I know your program. One of the biggest challenges that we had here in Burien when I was elected first was gang violence. And your doctors and your counselors, in fact, one of the kids that you all helped, one of the reportees, graduated. And it just brings me a lot of joy to see that. And remembering Elizabeth Juarez, who was a young 13-year-old girl that was shot, was concerning. But one of the things I want to be able to do, because I've lost connection with novels, to figure out, okay, what is it that you're doing? Your staff, it was a little bit more, more interacting with the city, and at the time it was more gang issues, right? Gang violence, and so. But the other thing is, I was going to talk to Mrs. Alian, that especially if she speaks Spanish, it's going to be great because there's 25% of the population in Burien is Hispanic, Latino, Spanish speaking. And so I'd like to see if maybe, because you're just saying it could take a month to 2 years to build trust. Okay. And I understand that, man, as a Latino man, we had to build trust over time, to figure out who we could trust because we didn't know, somebody was trying to get us deported or, they're trying to do this or trying to do that with my family. So I can know how hard it is to build trust. But the question here is, what are the tools we can get? Because I see somebody eating, that's a human right. Somebody should be able to eat, shower, have a home. But what tools do we have to be able to say, hey, because if we're talking to someone, maybe buying a sandwich or buying water, what other tools can we have? Because you all go to school for this stuff, right? I mean, you're all professionals. We're just regular people in the community trying to, pay 2-3 jobs, try to pay our bills, try to pay our taxes. And so we'd like to see what tools can you develop, or one pager maybe, of what we can do to build trust. Because you all have been taught how to build trust. We as a community have never been taught how to build trust. So we have to rely on our experience, whether we have past experience or not, or if you've been a privileged individual. And I can tell you, my son's a Latino privileged kid. He went to high school, went to college. He has a master's degree. And so he's never had not have a dad. So I would like to be able to say, hey, man, you go out there and you talk to someone, son, this is what you need to be able to do. If you don't want to send them to methadone clinics, at least show them where we can go eat, or how did you build trust. But I would say that would be something that I would love to see from you all is, what can we do? So thank you.
Can I say something? First of all, I did not go to school for this at all. I come from a very colorful past, in and out of incarceration, addicted to drugs for many, many years. I now have 23 years sober. I have purchased my own home. I've gone through a lot, and it's the lived experience that drives me. Every one of my teammates have all of them have some form of lived experience. This is what drives us every day 7 days a week. Yes, we're supposed to work 8 hours a day. No, we do not. We answer the phone on weekends, Saturdays, Sundays. It just doesn't matter. The one thing I can say that might potentially help the community is just reaching out to those of us that do the work instead of constantly giving them something. When you see a person in need, if you just continue to give them the hot meal, give them the blankets, give them the tents, they're going, why would they leave? Why would they leave? Because they're getting everything from here. Why would you leave if you were getting everything? No. So call on the people such as us, all of these agencies here. Call on us and let us get to the root of the problem. It's like putting a Band-Aid on a gunshot wound. You don't want to do that. You want to call the people that know how to service these folks, no matter what their ill is. We all have different areas of expertise. I don't know if everybody's expertise comes from lived experience, but I know I've been through it. Lived in cars and doorways and on the streets. I have a mini documentary on YouTube that tells my life story. It is there. So I've gone through it, and that's how I build the trust with these folks out there, because I can offer them a piece of my story, and then they see that I can relate to what they're going through. And a lot of times I get tears. I get more folks that are receptive to what I'm saying than those that are not. So that's why I believe our success rate is so high, and we will continue to go. We will continue to build, and we will continue to try and expand this program and get the exposure we need till we have it in all 52 states. That is my goal. I started this back in 2019. That's what I have to say.
Thank you. It's very powerful what you shared about your personal experience. So
sorry, can we make sure that we get your contact? I've been trying to figure out the contact information, but I definitely want to reach out to you. And
to the speakers.
Thank you. Yeah.
Okay.
Thank you.
Councilmember Moore, you'll be the last comment.
Okay. I mostly just want to say thank you to everyone who does this work. You make such an incredible impact on our community. I mean, you see firsthand what a difference you make in people's lives. So you already know. You don't need us to tell you, but still you deserve to be recognized for that. I think I wanted to follow up with the comment from Councilmember Mata about building trust and what the community can do. I'm not a professional in this field at all. I do volunteer work sometimes, but I do know a decent amount about data, and I know that our unhoused population is disproportionately targeted for harassment and violence. And so when we're talking about trying to establish trust with people who come from often backgrounds of trauma, backgrounds of abuse, backgrounds of experiencing violence and being let down or let fall through the cracks, it's really hard to ask somebody who's gone through that to trust random strangers on the street. And they're not entirely wrong to have that level of distrust, knowing that they are targeted specifically because they are unhoused. People who have mental illness, they are disproportionately victimized as well. So they are targets for people who would do them harm. And sometimes those people come with a smile or handshake or acting as though they are coming in goodwill. So the work that you all do to establish that trust with people, no matter how long it does take, as time consuming as it is, that is so valuable. And it's not something that most average people on the street can do in the moments that we pass somebody by. It's something that takes a lot of intentional work. So I just want that recognized. I want you acknowledged for that. And I know that in a system that has so few resources, such little to offer, that it's stretched so thin, when you're trying to get people into housing or shelter and there's just not enough beds available, or there's just not enough housing available, or you have 50 people you're trying to get off the street right now and you have 5 houses that maybe they can get into next week. You know, it's stressful and it's difficult. And so not only are you putting in the time and the effort, but you're dealing with an immense amount of physical and emotional labor. So I hope that our community really acknowledges that. And I just personally want to say thank you all so much for what you do. And thank you for being willing to come out and educate our community, because there are a lot of questions people have, a lot of concerns, and there's a lot of misinformation. And you all know that. So making sure that people have awareness is really important. Thank you all.
Thank you, Sydney. This is Ravenna Candy from Navos. When we were talking about trust building and the high percentage of substance use disorder in the population that we serve with our housing programs, I wanted to make it clear that it is low barrier housing in that we have a harm reduction model. So it's not clean and sober. You don't have to be clean and sober in order to enter. We understand that entering, many of our clients have severe drug addiction. And so what we do is we work to increase access to evidence-based harm reduction strategies like overdose prevention or syringe access programs. It's a public health philosophy and intervention that seeks to reduce the harms associated with drug use and ineffective drug policies. And the harm reduction model is evidence-based, and the University of Washington School of Medicine makes it very implicit that that's a super important part of our treatment so that we're not turning people away that are on the streets using. And we have substance use disorder specialists on the team, along with peer support specialists with lived experience that work together to help these individuals. So I just wanted to make that clear as another way to build trust is that model of evidence-based model of harm reduction.
Thank you, Ravenna. I really appreciate that. And I am a very firm believer in harm reduction based on the data. And I know people who live at Navos, and they are very grateful for the work you do. So,
and I think we could have another discussion that was a little bit more thorough and defines a lot of the terms that people are using, because I have some knowledge about what that is, but we don't really stop and define. And at the same time, also, what's the ultimate goal for people is something that I just would like to hear from all of our service providers. So thank you all. I wish we could devote this entire meeting to your work, because I think that's the space that we need to really understand what you do and what your goals are. So thank you for coming today.